This skill is applying a wet to dry dressing. Before you begin this skill, make sure you have a physician's order for a wet to dry dressing. It will be ordered in different manners. Sometimes it will say normal saline wet to dry dressing change daily, BID or TID. Just make sure you have a physician's order before you perform the dressing change. The next thing that we'll want to do once we've established that we have an order is we want to knock and enter the room. We want to identify the patient. This is Miss Janet Long. We want to explain who we are. My name's Tracy. I'm a nurse and I'm going to be performing a dressing change today on your bottom. Make sure you put it in terms that the patient understands. This wound is on her coccyx, but she does not probably know what that term means, so we want to put it in terminology that the patient understands. We can also go into detail about what we're going to be doing to her. That's explaining the reason that we're doing it. We're going to perform what we call a wet to dry dressing change. And basically what that means is the dressing will go on wet and it will come off dry. Remember, the purpose of a wet to dry dressing change is to debride the wound. That will allow for wound healing. Once we've explained the reason that we're doing the dressing change, we want to make sure that if there's any teaching that needs to be done, the appropriate people are in the room. A lot of times when you have a patient that's getting dressing changes and they're going to be going home, the family, caregiver, or the patient themselves may be doing the dressing change. So you want to allow whoever is going to do those dressing changes to be present while you're doing that. Okay, so make sure you're allowing for teaching to the appropriate people. Then the next thing that we'll need to do is assess the patient. Basically what we're doing in this part is we're assessing, are they going to be able to tolerate the wound care? Usually that means, are they going to be in any pain? We will have to ask them, are you in any pain? Do you usually have any pain when you're getting the dressing change performed? If they are in pain, or they anticipate that they will be in pain during the dressing change, we may need to administer a PRN pain medication. Once again, this is ordered by the physician, so we would administer it as ordered and as needed. If we do have to give them pain medication, we want to allow them time for the pain medication to work effectively. Typically that would be 30 minutes. So if you do have to give them pain medicine, make sure you wait the appropriate amount of time before you begin the dressing change. The next thing that we'll want to do is we'll want to wash our hands, and then we want to assemble our equipment. For this skill, the equipment that we will need will include a pair of clean gloves, a waterproof pad to go underneath the patient, a biohazard bag. I think in the lab manual it refers to it as a refuse container. This will go down in the trash can in order to dispose of the old dressing. We'll need some sterile normal saline. Once again, this is going to be whatever solution the physician has ordered. In this situation, it's normal saline. A roll of tape. Some cotton-tipped applicators or Q-tips. The number that you need depends on exactly what you're going to be doing, how big the wound is. In this case, for this wound, we just need 2, which is enclosed in this package. A tape measure to measure the wound. A pair of sterile gloves. Make sure they are appropriate size for you. A 4x4 gauze, or whatever appropriate size gauze you may need. It really depends on the size of the wound. For this wound, we will just need 1 4x4 gauze to put into the wound wet and 1 4x4 gauze to cover the wound. And then you will need a what they refer to as a combine pad on this package. They're also known as ABD pads. They are absorbent pads. They help absorb any drainage from the wound. And those are the supplies that you will need for this skill. The next thing that you'll want to do is you want to make sure that you're going to have everything in a good working order for you. Make sure that you're adhering to your sterile technique that you have learned. That would be having your table at waist level. You want to make sure your bed's at a good working level. And if there is a curtain in the room, you want to make sure that you have closed that privacy curtain so the patient does maintain privacy during the procedure. Remove the call light. Once again, make sure that during this dressing change you are promoting their involvement. Once again, if the family is going to be involved in any type of wound care, that they're in the room and they're involved in it. And then during the wound care, you want to assess their tolerance to the procedure. The next thing that we'll want to do is we want to put the waterproof pad underneath the patient. Now, if we were doing this on a real patient, more than likely we would have them in a Sims or lateral position in order to access the wound. Most people won't tolerate being in the prone position, so you would actually probably have them in their side lying position. But for this skill, and so you guys can see what we're doing, we're going to put the waterproof pad under them. We're going to take the biohazard bag and we're going to put it the biohazard bag in the trash can. The next thing that we're going to do is we're going to loosen the tape up on the old dressing. Now, your skill book does not require you to have gloves on at this time. However, if your wound has drainage and you see visible drainage on the old dressing where you would be loosening the tape, you would put gloves on at this time so you did not come into contact with any bodily fluids. You may also need to use or can use an alcohol pad to help loosen the dressing up. Now, I'm not going to do that on this one, but if you needed to, that you can. And if you notice that I'm pulling the tape even with the skin, I'm not pulling away from it. That helps loosen the tape without damaging the skin. And once again, you can use an alcohol pad if you need to. Now, at this point in time, I would put my gloves on because I'm going to actually take the old dressing off. Now, these are my clean gloves that I'm putting on at this time. Okay, so I'm going to remove the top dressing. This is the old one. I can look at the drainage on it and I can discard it. Then I'm going to remove the dressing that's in the wound. Make sure you know exactly how much dressing is in the wound. For example, somebody may have put in 2 4x4 gauze. So you want to make sure that if the previous nurse had applied 2 4x4 gauze, that you are withdrawing 2 4x4 gauze from the old dressing. Once again, we're also going to look at the drainage. We also want to assess for any kind of odor that may be present. You're looking for those signs and symptoms of infection that we have discussed in the wound care lab lecture portion. Remember your different types of drainage that may exist: serous, serosanguinous, sanguinous, and purulent drainage. Remember also to look at the amount that there is, which would include scant, small, moderate, large. We've discussed those terms in that lecture portion. And dispose of that in the garbage. Notice I'm not really going to throw it down in the garbage. I don't want to accidentally touch my gloves to the garbage can. The next thing I want to do is I want to look at the wound itself. And once again, this is going to be terminology that we have learned in the first portion of this lab. We're going to look at the wound bed. We want to see if there's granulation tissue. Remember, that's your beefy red tissue. We want to assess for any slough. That's the yellow stringy tissue. That's what we're trying to debride out of the wound with a wet to dry dressing change. We're wanting to look and see, is there any necrotic tissue? Remember, necrotic tissue is going to be black or brown in color. And we're wanting to see if we see any visible bone or muscle exposed. Now, with this wound, I have 50% granulation tissue. I have 40% slough that's being noted, which means 50% of that wound's healing, 40% of it has slough, and 10% actually has bone that is exposed. Now, you may not have to get that detailed wherever you work, whatever facility you work in. They just may want to know, what do you see when you look at it? So make sure you follow the facility's policy and procedures in regards to documentation of the wound bed. The next thing that I want to do is I want to look at the wound edges. I want to see, how do those wound edges look? Now, this is an open wound, so really what I'm concerned about is I want to know, are those edges edematous, or are they staying too moist? You'll hear a term called maceration. We probably discussed that term in the first portion of this lab. That means those wound edges are staying too wet. And so we'll want to make sure that when we're putting that wet to dry dressing in there, that we're not leaving that dressing too wet. If those wound edges are looking like wrinkled skin or wet skin, how it appears to be, that would be a good indication of that. Then we also want to see, are the wound edges reddened? Now in this wound, we don't have any wound edges that are reddened. There's no swelling, no maceration. The next thing that we'll want to do is we'll want to actually measure the wound. Now, measuring the wound involves two different steps. We have to measure the length and the width, and then we have to measure the depth, and also look for any undermining and tunneling when we're measuring. So with this tape measure, you have two different areas that you can use. The inner portion is measured in a perfect circle. Most wounds are not going to be perfectly circular. The majority of the time you will have to use the measuring guide that's in centimeters that's on the side of the tape measure. Now there are other types of tape measures on the market that will only have the centimeters measurement just like it is on the side. This one you've got a few different options. So what I'm going to do first is I'm going to lay the tape measure over on the wound, on top of it. Now I'm not touching the inside of the wound because remember that's sterile. I'm simply laying it over the top outer portion of the wound. Now to measure length, it's measured on the 12 to 6 o'clock area, and we will look for the longest part. Now for this one, the longest part at that 12 to 6 is going to be at 5.3 centimeters is what we're measuring it at. Width is going to be 3 to 9 o'clock, and so I'm going to lay the width area, or measure the width area from 3 to 9. And at the widest area of that, we're going to get 5.2 centimeters. You would want to document these measurements. If you have trouble remembering those numbers, I would have an ink pen handy to write all this down because you're not sterile at this point in time. So you can write on something, okay? Now you still have got to measure the depth, and you've got to assess for any undermining and tunneling that may be present. That's going to require the use of a Q-tip. Now, you want to make sure that one of these Q-tips stays sterile. So what you'll need to do is you'll try to open this package without touching but only one of the Q-tips, just like I did, okay? Now there's different ways to open that package where you're pulling the one out so that you're not contaminating the other. But if you can do it just like I showed you, that would probably be the easiest way. Now, if you remember, undermining is basically a lip that's occurring at the edge of the wound. And so you would be able to take a Q-tip and stick it underneath that outer edge of the wound. So if you look here, and once again, once you've touched the inside of this, that's sterile. But if you touch the outside of your Q-tip, or excuse me, if you touch the outside of the wound with your Q-tip, then it becomes non-sterile. You've contaminated it. You can't go inside the wound with your Q-tip. So I'm taking this cotton tipped applicator, and if you can see on the video, I'm going completely around the outer edge of the wound underneath. So this actually has undermining around the entire circumference of the wound. The next thing that we'll want to do is assess for any tunneling. Now remember, a tunnel goes down into deeper areas of tissue. You will actually be able to take your Q-tip and stick it down into what will be a tunnel or a hole. Now with this wound, we actually have a tunnel that's located at 1 o'clock. And if we go all the way around, we will have another tunnel that is located at 9 o'clock. Now some facilities will require you to measure those tunnels. And if they do, make sure that you follow those guidelines and measure them appropriately. For today's skill, I am not going to show measuring the tunnel. It would be done the same way that we would measure the depth of the wound. You would just document where the tunnel is located. You would say tunnel at 1 o'clock. And if the facility requires you to measure that tunnel, then you would document what the measurement of that tunnel is at that time. For depth, we're going to look around the inside of the wound, and we're going to try to find the part that is the deepest part. Now, for this wound, the deepest part is actually at the bottom portion of the wound. Okay, so it's going to be closer to what we would say 6 o'clock. And you'll find the deepest part, and then you will take your fingers and you will pull up right where you saw the actual depth. Okay, and you may even have to get down. That's fine if you need to get down to find out where that is. And then what you'll do is you'll take your Q-tip and you will put it right against the 0 measurement on the tape measure. Where your fingers are at should be where the 0 for the measurement would be. And then you're going to see where that Q-tip will end, or the cotton tip applicator ends. In this case, it's ending at 1.5 centimeters. So this wound is 1.5 centimeters deep. Once again, make sure you write that down if you think you will forget that. Okay, at this point in time, we are done with this cotton tip applicator. We can throw it in the garbage. We can remove our gloves and wash our hands. Now, you don't actually have to go wash your hands in the skill, just verbalize to that you're going to wash your hands. The next thing that we would do is we're going to prepare everything. Also, this, you can dispose of it. The tape measure, you're not going to use that again, so you can just discard it. We're going to get everything ready for us to perform the actual dressing change. The easiest way to do this is to have everything in order of how you are going to need it. So, the first thing that I'm going to do is I'm going to open up my packages that I'm going to use. My gloves will be put on in just a minute after I've gotten everything ready, so I'm going to set them over here to the side. Remember, I had already opened my Q-tip earlier a little bit, so I'm going to go ahead and open it the rest of the way. Be careful not to flick it out onto the table. That sometimes happens. Just make sure you pull gently. So that it's open where you can access it. Okay. Next, I'm opening my package of 4x4s. Remember, one package will be wet, and one package is going to be dry. The dry one just to help absorb any moisture that may be present. My ABD pad's going to be the last thing that I put on, so I'm going to go ahead and have it last. I'm going to go ahead and just have my tape ready to go. I can't stick it on here because that's not good standard precautions. Just have it ready to go like that. On my saline, we talked about earlier that it need to be sterile normal saline. If it's a new container that's never been opened, it's sterile. Once it's been opened, it should have a date of when it was opened and that person's initials. You'll still want to make sure that the solution has not expired by looking at the actual date on the bottle. The first thing that you're going to do is lip your solution. We've talked about lipping already in class. So make sure that you pour your solution into your refuse container. Now, the amount of solution that you are going to pour into your 4x4 really depends on how wet you need that to be. If you have a wound that drains a lot, you probably don't need a lot of normal saline on your dressing. If you have one that's not draining very much, then you would need to put more saline. Just remember what your goal is. Your goal is to have a dry dressing on there at the time of removal in order to debride the wound. So for demonstration purposes, we're just going to put a very small amount on there. We're going to say that our wound has a small to moderate amount of drainage. The next thing that we're going to do is put on our sterile gloves. You've already learned how to put on sterile gloves at this point in time. And we've taught you guys how to just get rid of that so that it's not in your way. Okay, the first thing I want to do is I want to pick up my wet gauze. Now, if it is too wet, like let's say you accidentally poured too much solution on it, then you can take it and wring it out over your trash can. Do not drop your hands below your waist though, because remember that would be breaking your sterile technique. Keep your hands above your waist level. I didn't pour very much on there, so there was nothing to wring out. The next thing I'm going to do is I'm going to do what's called fluffing my gauze. Now, fluffing your gauze is simply opening your gauze so that it's ready to be packed into a wound. You want to make sure you've opened it completely. Do not touch it to anything that's not sterile, or it is contaminated if you do. Once you have opened it completely, and sometimes this takes a little bit of time to get it opened all the way, you'll want to lay it in one of your hands. Now, I do it in my non-dominant hand. Everybody's a little different in how they do it. I think it's easier just to put it in your non-dominant hand because you're going to use your Q-tip in your dominant hand to help pack that wound. Now, when you get ready to pack your gauze into your wound, do not pack it tightly. It needs to be loosely packed into there. That's what wet to dry dressing change. Any kind of dressing change that involves pack and wound is always done loosely packed. That allows for wound healing. Now, I picked up my Q-tip. It's sterile because it was still sterile in that packaging. And I'm going to try to just hook some of that gauze around the end of the Q-tip. What I'm going to do is I'm going to start loosely packing without exposing any of my gauze to the outside of my wound. Now, this sometimes takes a while to do. The big thing is you want to try to keep sterile to sterile. Without touching any of the outside of the wound. And remember, I said we're going to loosely pack it. So what will happen is once we're done with this, we should be able to see that the wound is completely covered, but it's not covered to the point where you couldn't probably push that gauze down some more and get some more in there. But you want it to, like I said, be loosely packed. You also loosely pack your tunnels. You don't want them to be packed to the point where they're not going to be able to heal. So I'm going to put some gauze down in my tunnels, just like so. And notice how I'm also using my finger of my non-dominant hand to help guide my dressing. If you have a wound that does not have any tunneling or undermining, you probably can use nothing but your hands to lay the dressing down into the wound, because remember, it's sterile to sterile. However, if you have undermining or tunneling, you'll need to use your Q-tip to help guide it into those areas. Okay, once you're done with this, you can dispose of your Q-tip. Once again, don't drop below waist level with your hands. Take your dry gauze and you're going to lay it over on top of that wound, just like so. Remember, the purpose of this dry gauze is to help absorb any moisture that could be present in addition to your ABD pad or your absorbent pad that you're going to put on them. Now, when you put the absorbent pad on, you have a couple of options. You can lay it straight across. You can fold it to where it's more the size of the wound. Whatever seems to be appropriate for that dressing, okay? So what I'm going to do is I'm going to just lay it straight across like we had on the previous one. And at this point in time, I would be ready to put my tape on here. Now, your tape is not sterile, so technically your sterile technique is done at this point in time. However, if you refer to your book, it wants you to put the tape or Montgomery straps on with your gloves on. Okay, so beware that it will probably stick to your gloves. And I tell students, once again, if your gloves are really saturated, you may need an extra pair of just clean gloves to put on after you apply this dressing if you do have any kind of drainage on your gloves, because you don't want to get that drainage on your tape. Now, don't over tape. A lot of people like to over tape. Only apply tape to the amount of skin that needs to have tape applied to it. For wounds that are on the coccyx, make sure that you get a really good seal at the top of the buttocks, right below the coccyx area. That way, if you have someone who's incontinent, there will not be any urine or bowel movement to come up through that tape. Also, that area tends to have more moisture, just perspiration, so it's easier for the tape to loosen up right there. So make sure you get a good seal in that area. And then at this point in time, you can remove your gloves. Remember to practice your standard precautions for glove removal. You also would like to put the date and your initials and also the time on this dressing. So what you could do is you can take you a piece of tape and just write that information on the tape and stick that piece of tape onto the gauze. So I could put my date, time, and initials on here and then just stick that tape on the gauze. If you were to think ahead of time before you even got sterile, you could actually go ahead and write date, time, initials on that ABD pad. Just be careful though, because you don't want to put the side that you've written on the bottom side next to their skin, okay? I would advise using the piece of tape just like I did with the date, time, and initials on there. At this point in time, you'll want to make sure that you will raise the bed, side rail, lower the bed. You want to get them covered up also. Go ahead and give them their colite. So I've gotten them comfortable. I can go ahead and remove any extra things I may have sitting on their table at this point in time. Dispose of that in the garbage. And then I would wash my hands and document. Now, as far as documentation goes, you're going to include what you did, which would be applying the normal saline wet to dry dressing. You can document that as a sterile dressing change that you performed, especially if that's what you did. You want to document that it was sterile. Depending on the facility, you may or may not have to document exactly what you did step by step. It really depends on the facility. If you do, make sure you include the supplies that you used, the exact number of gauze that you applied to that dressing. Like I said, if it's 1 4x4 or 2 4x4s that you've packed into that wound, you need to specify that. Your assessment of the wound should also be documented in your narrative, which includes what did the wound look like, what did the drainage look like, was there any odor. All of those signs and symptoms of infection need to be included in that documentation.